Hi, everybody. My name is Natalie Yeadon. I'm the CEO and co-founder with Impetus Digital. At Impetus Digital, we have built some of the best-in-class asynchronous and synchronous virtual collaboration and communication tools. We have worked with life science companies from across the globe over the past 13 years to help them with everything from digital advisory boards to virtual investigator meetings, medical education online. And since the launch of our award-winning Insight Events platform, we've been helping pharma companies with large innovation hackathons, MSL training, as well as all sorts of large corporate events. But more importantly at Impetus, we really believe that everything starts with a conversation. And from these big, hairy, audacious conversations with some of the leading edge thinkers, digital provocateurs, and healthcare thought leaders, we can all work to collectively and positively disrupt healthcare. So I'm super excited to be having one of these thought leaders at the table today. This is actually Christina Stokes. She's actually the founder of a company called CyberRhythms Consulting. This is actually a cybersecurity consulting firm that's based in Cambridge, Massachusetts, where she's focusing on cybersecurity policy, cybersecurity compliance, international cybersecurity, and cybersecurity awareness. She also writes about the various cybersecurity topics around such things as awareness, education, policies, and technology at cybersolace.io. Christina was born in the Philippines and was raised in Asia as well as in Europe. She holds an MS degree in cybersecurity policy as well as holds an MBA. Welcome, Christina. So happy to have you on our show today.
Thank you so much, Natalie. It's great to meet you. Thank you for having me on.
Awesome. I have to tell you, I use the word cybersecurity quite a bit there. And we know that, since the evolution of the internet, which is, really quite frankly, not that old, we oftentimes don't really see people get into this as a profession. Tell us a little bit about your career trajectory and how you ever decided hey, I want to get a master's in cybersecurity.
Well, my background was actually in marketing. I was a writer and then I shifted into marketing and I did tech recruiting as well. But seeing the data that I could gather from my tech recruiting pursuits, as well as data that I gathered from marketing, it really enlightened me to just the type of critical data that we see every day. And I became concerned about how that data could be accessed and the different types of personal data that I was finding. But I was also viewing it as a parent as well, with concerns about my children and the future. So I decided to shift into cybersecurity with the hope that throughout my career, I could help make a safer cyberspace as we move forward and technology evolves.
Very, very cool. And I love it. Good for you. Now, I also, now you're in this area where you're working with CyberRhythms Consulting. Can you tell us a little bit about how you evolved into basically becoming a consultant, entrepreneur, and what kinds of projects do you work on in your company?
So the types of projects that my company takes on right now are in cybersecurity research as well as cybersecurity policy. So we work with different companies and help them find the right types of policies to align their projects with, depending on what their projects are on, as well as cybersecurity education and awareness. So helping small businesses, especially with cyber hygiene procedures and protocols within their own companies to make sure that they're keeping their data safe and that their operations day to day are secure.
So I love that word, cyber hygiene. So for the average business or businesses in general, what are some of the tips that you share with people on what makes good cyber hygiene?
I think definitely using strong passwords. We hear that a lot, but definitely using strong passwords and making sure that your software is up to date on all of your machines, including mobile devices, and encrypting mobile devices especially is incredibly important, especially as we see more telecommuting. And as we saw through the pandemic, the number of instances where telecommuting has risen. All of that is incredibly important to make sure that your company's data is secure.
So Christina, you started your consulting company before the pandemic. Obviously, there was security issues and concerns and threats before then. Tell us what has happened to companies since the advent of the pandemic.
I think, what we've seen throughout the pandemic is, more and more companies are allowing for a more flexible type of work situation. So we have more people working from home and away from the office. And we see that in different industries across the board. So these companies need to know, what information is being accessed by their employees and what of that information needs to be secured in different ways, depending on what type of data that is, but depending also on that employee's role and what level of access they have. So that defining those different areas and making sure that people can do their jobs without any limitations and without any threats is going to be important. And we've seen, more instances of that over the last year, 20 or more than a year now.
Yeah, absolutely. Now, one of the things that we hear every day now, it used to be an anomaly and now it just seems to be a day-to-day occurrence, is these hacks that are going on. We just recently heard yesterday about, I believe it was Coinbase, and there was like millions of emails. And I mean, this is literally happening on a daily basis.
Yeah.
How is a company, and of course we're hearing about all this trolling that's happening and, hacks, and people are putting people at ransom. And, we even heard that it recently happened, at a governmental level, hospital levels. So how are these institutions, companies, organizations ever supposed to protect themselves against these bad actors?
That's a great question. When we see it with hospitals, for example, I think it's important with any healthcare organization to create a culture of security. But security goes beyond just that security team at the hospital. It's the responsibility of everyone in every role at every single company. So it goes beyond, of course, policies and guidelines and your day-to-day practices, but to create a culture of security and for everyone to understand that they themselves are responsible for helping to secure data and protecting data and making sure that they're taking actions that help eliminate threats will help keep organizations maintain a level of security. I think it's important also for organizations to maintain a level of awareness with what we see coming as technology evolves, but also how healthcare practices evolve. So we're seeing more and more patient healthcare provider relationships expand outside of that clinical setting into a more telehealth type of communication. So whether they're accessing, patients are accessing healthcare data on mobile devices or through their own personal computer, or it is one of the workplace members or the clinician themselves accessing that and doing telehealth appointments through portals, we're going to see, the risk of security there as well. So we need to learn what the potential threats are going to be and what data needs to be protected, and everyone needs to work together to help secure that.
So you said something really important, Christina. We're seeing this, obviously, like I said, there's been this huge inflection point and this momentum behind telehealth, decentralized clinical trials, interoperability, and these utilization of these patient portals. And there's tons and tons of data being collected, specifically through what we call patient reported outcomes. And this stuff is just getting added in to these data repositories. So what are some of the things that one should be considering when collecting data? Is there variations in the kinds of data and how each of these data types should be collected and stored? What kinds of advice would people be looking at when they start to think about this immensity of data and the risks associated?
Right. Well, there is, the patient informational data that you're gonna gather. So we're talking about first name, last name, social security numbers, birth dates, addresses, but then we're also gathering biometric data and biomedical data based on that patient and the type of care that that patient needs. And that can be physical care, mental health care. So we want to look at the different types of data and what you're gathering, how you're collecting it, how that data is being provisioned, how that data is being stored, and for what length of time. Also, when appropriate, how that data is going to be destroyed, whether it is hard copy or electronic. So there are a number of different ways to look at all of the types of information that is being gathered from a health provider's perspective.
We are also seeing this incredible utilization of interoperable systems just to reduce the friction, if you will, of data collection and reception. We're trying to make it really easy for various machines to talk to each other, various algorithms, various machine learning tools. And that actually reduces the requirement of manual entries. So you're talking about biometrics, the seamless use of ambience just flowing through the smartwatch or the 24-hour glucose monitor, whatever, and it's going into these data systems. What should we be thinking about around edge computing? So data staying and residing in the actual resident computer versus it getting encrypted and moved into these repositories that are shared in aggregate. What sorts of policies need to be enacted in order to ensure safety with the data?
First off, I think we need to have the patient opt into that. So when we have people wearing these different types of tools that help us collect that data, whether it's a smartwatch that is collecting data and holding it or sending it off to their healthcare provider where appropriate, we need to have the opt-in of the patient. So they need to be aware that they are sending that information to their healthcare provider, but that their healthcare provider or whatever app they might be using could be sharing that with third parties. And for them to have that level of awareness and ability to give permission and understand the terms as well is, I think, really important and really key, because it is your personal information and it's your right to share it or not share it with whomever you want. But we do see people who are using those tools take more ownership in their health, and by eliminating the friction between communication between themselves as patients and their healthcare providers, or being able to visualize their health data through a number of various different health apps, it does help increase someone's ownership in their own health. So there are positives to it as well as there are risks.
Absolutely. Now, it's kind of interesting because there's a couple of things I just kind of want to unpack here. And one of them has to do with understanding. So it's not, there's a comprehension piece to what you're giving consent to. We've been hearing a lot about the issues, again, recently with the Hogan issues with Facebook and what was released and what was known. And we're starting to hear about all of these, idiosyncrasies around what kind of data is collected and how it's used. And we've just even heard recently that Facebook is going to stop using any of this facial recognition software. And so in some ways, there's an embedded layer of unknowingness associated with a digital citizen thinking that they're giving consent, but not really understanding what they're giving consent to, and more importantly, what is potentially going to be happening with their data. What needs to happen around policy on this and the bigger picture as more and more of these big techs and small tech companies start to playing in this game?
I think as individuals, we need to understand what our digital rights are as citizens. And also, I think going forward, we're probably going to be seeing more regulation by the government based on what type of information is being collected. For example, in Singapore, there are actually government regulations based on what type of medical information can be collected by healthcare providers and how that data is used, and what what happens if there are violations to that. So I think going forward, we will be seeing more movement toward regulation possibly, and more definitions around what our digital rights are as citizens, because our information is being monetized at times without us even knowing it. And what we give our attention to is also being monetized without us even being aware. So in that way, you as a consumer are a product yourself, and that crosses lines into being unethical.
So what, in your opinion, are the potential dangers and vulnerabilities of the Internet of Things? And now we realize that the IoT is now passé. We're now in the metaverse. And everybody is, and his brother in the big tech world are now starting to build into this metaverse. We already know about NFTs, and we're hearing about cryptocurrencies, and people are trading and buying real estate in these little mini universes that are happening. It's a whole new world, AR, VR, mixed reality, et cetera. So do we know what we're getting into, and what are the dangers?
There are a number of different dangers as technology evolves. Some are known, some are unknown. But I think what we're seeing is more frameworks that can help with, for example, there are AI frameworks that are now coming into play, that are going to be important and key as we move to a more digitized world in that sense, like when you're speaking of the metaverse. But there are also increasing vulnerabilities that come with that, because it's now becoming an extremely personal integration with your life and your day-to-day activities if you opt in to using those types of tools, whether it's on a personal level or whether it's a company that is doing that with virtual meetings. But there are and can be a lot of dangers that come with that. Not to sound scary, but
Yes,
there
no,
are
I
risks.
mean, there's the utopian and the dystopian view on it. It depends on what side of the table you sit on, but it does actually make you wonder about the ethics behind some of these cyber policies. And so what are some of the ethical or bioethical concerns that you have heard of that are kind of popping up everywhere as we're getting deeper and deeper into into this digitized world that we live in?
I think, one of the things that come right off to top of mind and also just tying back to the healthcare industry, when we're seeing cyber attacks on these types of companies and the hackers are trying to get personal information, they're disrupting networks, we're seeing denial of service attacks. That goes beyond attacks on an organization and then them being financially liable for that. So we're moving beyond a financial loss or even an impact to an organization's reputation, but because it impacts patient health care, physical care, you can then create physical harm to a person. So now we're talking about losing lives. So when it comes to the ethics of these policies, making sure that organizations are implementing these policies and creating a culture of security and creating a safe space that's non-punitive so that their employees can raise their voices when they are concerned, if they see violations or deviances from procedures or protocols that they know are safe, I think are incredibly important. Because if you don't, like I said, we're talking about going beyond an institution just being hacked. We can see an impact to someone's physical safety and cause harm or loss of life. And that's, beyond, anything that I think, it's one thing to disrupt a computer network. It's another thing to see a loss of life because of it.
I'm actually curious about your opinion, Christina, as well, on this world of liability and accountability. As we start to move into this place of machine learning, robotics, machines making decisions, again, biased or not, and the impact. And then also intrinsic in that are the policies associated with how we use these algorithms. And I'm just thinking about Facebook as an example, knowing that they had data supporting that they knew that there was some mental health issues, or they were exacerbating certain eating disorders, which again, at the end of the day, it's technically a machine that's impacting the health and welfare of individuals. Who in this new digital world is going to be liable and accountable as we start to move into deeper and deeper concepts of digital surveillance?
I think that's a great question, and that's definitely a question that has been up for debate. Who is liable? I've had so many conversations with different types of cybersecurity professionals specifically about that. It's a great question. It's a difficult one to answer. But if a company knows that they are impacting their customer base, or in the case of social media platforms, their users in a negative way, and then continuing to do that, I think there are potential implications for them, because they're continuing to do it knowing full well that they are causing and creating harm. I think that's an unethical practice. And if you're doing it simply because there's monetary gain in it for you, I think that's unforgivable. So that's my personal opinion. Yeah.
Yeah, absolutely. Now, I think that the world is also really evolving. I'm hearing more and more about these cryptocurrency cities that are starting up. Let's be honest, there's entire countries who are taking this on. But anyway, there's cities that are starting. They're called smart cities. And intrinsic in that are going to be smart homes and smart hospitals and smart everything. What are some of the concerns or challenges or advantages that some of these smart cities going to see in the future?
I think there are both advantages and disadvantages. There's the advantage of convenience for people who have smart homes, and being able to use city transit easily with smart cities. There's the potential of positive impact to the environment as well. However, and then to law enforcement, if you're trying to work out a case and find somebody's whereabouts, or even in some cases finding out when a heart stopped based on their smartwatch, you have that data accessible. However, we can cross into a line of surveillance where you're being surveilled whether you want to be or not. In a smart home, in a smart city, all of your movements are tracked. So it's going to go back to what people are going to voluntarily opt into. And as long as there is a clear understanding of what they are opting into and giving permission to when it comes to their movements and their data, then I think, it can all work out quite well.
Yeah, 100%. Now, it's kind of interesting because when you were talking about surveillance, you were starting to just edge on this whole area more around politics and what's considered legal, correct, ethical. And when we do, for example, just pointing it out, not one particular, but, for example, China, we all are aware of the social credit system that they actually are using there. Now they've got sensors and they've got QR codes and basically embedded in everything, everybody's using smart money there. And so it's basically embedded in their society, and it's kind of considered, the messaging is it makes us safer, right? So what we're doing is we're taking complex human behaviors and we're incentivizing what we're deeming to be the right truth, the right reality, what society believes to be the right thing to do, and we're indirectly incentivizing it through social credits. Tell us a little bit about what we see as being the ethics of that, and does this may advantage China and disadvantage the US or Western politics or whatever? where does this play out at the end of the day?
So, here in the US, our freedoms are very incredibly important to us. I'm not sure if there would ever be a way that we could ever implement a system in our country the way China has been able to implement in theirs because of the political differences. Um, when it comes to freedom of speech and things like that on social media, there is this question of, is, your rights to free speech is important, but is, the freedom of speech equal to freedom of reach? So when you're using, your voice in a manner that can create harm or create misinformation, you're creating harm, period. So, the our ability to do that in this country, I'm not sure is something that could be a reality on the level that it is that we see in other countries. Um, you know, and that can make it difficult, especially in a situation where we have a pandemic. For example, Taiwan was a country that was able to kind of keep the pandemic under control because they were sharing so much information publicly in a very predictable manner, but they were also able to track the comings and goings of their people. We're not set up in that way here in the US, so we don't have that level. But again, because of our laws and our freedoms and the way our citizens hold on to those freedoms, I'm not sure if we would ever be able to reach that level of connection, of even digital connection. So we may not have that type of surveillance, ever see that type of surveillance here.
As we just think about also the data that's shared through health data and institutions and patient portals, and again, everybody's getting in. This is the next big disruptible area is healthcare, and everybody's getting into it. And data is the new gold. So everybody wants to get in there. They want to, create a mashup of data, genomics, other sorts of things to start, doing really great, new discoveries very quickly, very efficiently. And there's all kinds of things going on into that big pot. And part of this is this idea of blockchain. Currently, it's being encrypted or it's using edge computing and how we're doing this. But do we see a day where this data gets ported in using blockchain? Patients own their data, and every time somebody utilizes it for research or otherwise, that they get, paid. And could this become the new universal basic income for the average individual?
I think individuals should have ownership over their own data, whether that data becomes some sort of currency. Who's to say? We do, see ownership of that data on a lower tech level for patients here and now. So when you're switching from one healthcare provider to the next, you can, reach out to your previous healthcare provider after they've transferred data over and have them ensure that they've deleted data. So in one sense, you are owning your data. But, again, if you're opting into a program where they're sharing that with third parties, then you've lost control of that data, because once it's shared, it's out there forever. So, again, I'm not sure if data can be ever used as currency, because we can't have full control over data once it's shared and then shared again with third parties.
Yeah, very good point. Mashups. We hear a lot about these DAOs, or what we call decentralized autonomous organizations, and this advent of possibly replacing the current corporation or the way people make money, or the way we use intermediaries like lawyers, bankers, other sorts of people who sort of watch, there's kind of an intrinsic trust that's built, and they become they're the trustables, if you will. And that if we do a real estate transaction, we believe that person's the intermediary before, a contract. And so when certain parameters are met, then money is exchanged. In the new decentralized autonomous organization, algorithms are taking that place. So I'm just kind of curious, in this world, as we start to move into this new way, or these new ways of doing corporations, what is the ethics potentially of replacing the legacy structures like legal system, like the government, like bankers? What is this going to look like in the future?
So that is another great question. When we're talking about that, we're then getting into areas of data sovereignty. So we have, multiple different foreign laws that overlap, and sometimes they're working with each other and working against each other. With the DAOs that you have mentioned, there come a lot of questions that end up in play, such as, yes, they are decentralized, but is the country that the person who formulated that in or founded that in have ownership over that DAO in some sense? So there are a lot of questions because, are they truly decentralized? Even though they are in the cyberspace, they're still a physical person. There's still a physical server. And then, with those servers, we get into those areas of data sovereignty, and then foreign laws and, potential global policies. That is an area that I think needs to be further developed. I think we're seeing countries starting to work with each other to develop more in that area. But that is an area that I'm extremely interested in as well when it comes to international cybersecurity and cybersecurity policy.
It's absolutely huge. And I guess, intrinsic in all that is, how we're going to be making and navigating through this new world of, how are we going to be looking at ownership? And I guess that's really the key issue is in the future, are we going to be creating new definitions of what ownership of data versus shared ownership? And is there going to be a reframing of privacy, sovereignty? Is this going to look different in the future?
I think that depends a lot on the politics of the world in the future, and depends a lot on how well different countries can work together, or whether they choose not to work together. And I mean, we see that in cybersecurity with cybersecurity attacks, where is the accountability, who has jurisdiction, and so that all of those laws, it's it can be kind of a mess. But and I'm not a lawyer, but I think I think geopolitics is an area that needs to be looked at, especially when it comes to cybersecurity.
And I guess really just on the last question on that point of, the geopolitical, the constantly shifting geopolitical system is, will war look different in the future? Is it going to be 7 minutes on the battlefield with, military folks and, warplanes, or are we fighting a new kind of war? Is the Cold War going to be new? Is it surveillance? Is it hacking? So what is this going to look like in the future?
We've heard a lot about cyber warfare, and that being the next version of war, the next world wars, will be fought in cyberspace, and that is definitely a potential. With so many different countries becoming more technologized and the world just being as globalized as it is through technology, cyber warfare is something that could be very real, but I think is something that already is real, because we see nation states attacking each other, and surveilling each other in many different ways. And it's, just countries all across the world. So yeah, I think, cyber warfare is definitely something that will be real.
Yeah.
And is already in play.
So, but leaving this on a more positive note and looking more at the utopian view of the world, what are your personal hopes and plans for the future?
I'm hoping that the world will work together as opposed to against each other. I'm hoping that, yeah, I grew up in a very international frame. I'm from the Philippines and I grew up in Asia and Europe. I went to college in Italy and then relocated to the United States as an adult. So I have a very international perspective, and I think we are all more alike than we are different, and we all have the same hopes for peace and safety for our families. So though technology can be used for nefarious purposes, I'm hoping that we all choose to use it for more positive and peaceful purposes.
Love it. And I absolutely share your beautiful vision, Christina. This is awesome. For those people who are listening or watching the show and are interested in connecting with Christina for consulting, having discussions further, looking at some further collaborations or partnerships, please look in the show notes below for her contact details. If you enjoyed this discussion, I'd also encourage you to check out impetusdigital.com. These are the kinds of conversations that we do in our asynchronous and synchronous touch points with pharmaceutical companies, with their physicians, payers, allied healthcare providers, and patients, when we're actually having discussions about the brand, strategies, and tactics, moving policies, moving ideas forward. We actually have a series of touch points over time that we actually help you with our white glove service. So I would really love it if you can like and subscribe to our channel, and please leave us some feedback on iTunes. Thanks everybody for your time. Christina, this was awesome, and we wish everybody a great day ahead.